Welcome to another episode of the Prognosis. Today we have a fantastic entrepreneur with us, a clinician turned entrepreneur. Please welcome Dr. Reema Nadig on the show. Why don't you tell our audience about Kite Senior Care? What is that company?
When we were conceptualizing this business, we were thinking that there is a gap of outside hospital care for elders. We actually started as a small daycare model to see how we can help elders age. It was a very beautiful concept, accepted nicely by the surrounding neighborhood elders. Scalability was an issue.
There is transition care, there's palliative care, and there's dementia care.
These are the real needs of the elders. It requires a specialized care delivery model. It is not one shoe fit all.
Two USPs clearly comes out. One is that you are purely focused on geriatric care and you guys are clinicians. What are those small unfair advantages that you have, let's say, building this business compared to if a generalist backed with private equity money comes and builds this business?
There's the clinical operations, there is non-clinical operations. When we talk about taking care of elders, it is always clinical outcomes. I think this is the advantage of being a passionate clinician, having a knowledge about operations also. Whenever I also hire doctors, I go back to the first day of MBBS, which every doctor would have had a lecture on. What is actual medicine and how we should practice it.
Let's talk about competition in this space. In the last 4-5 years, we have seen a lot of new players getting funded. What's your moat?
The pie is pretty large. There are at least 200 more players to come into this. Very important is to get the cost structure right. 80% of the requirement of elders is health. Hospitals will get it, but the priority is turnover of the bed. So for me to keep the cost structure down, I have to have infrastructure and people designed accordingly that I'm able to sustain that. Hospitals may not be able to do that.